Good afternoon, Professor and classmates. My name is Victoria Vasco, and I'm going to be doing my case study presentation and going ahead and letting you guys know about a patient that I encountered. Currently, I am doing family practice, but I am having a major focus on OBGYN, and I have realized how little I actually know about pregnancy and maintenance of a pregnant woman during her pregnancy. So, this particular patient, we'll call her Emily. She's a 30-year-old female. She is 20 weeks pregnant. She's gravida zero, or I'm sorry, gravida one, para zero. Her main complaint, obviously, is just a well check for being 28 weeks pregnant. Her second complaint is back pain, and her third complaint is an active case of genital herpes. So this patient presented to the clinic, like I said, at 28 weeks pregnant. Overall, she feels well. She's noted good fetal movement. She complains of low back pain after standing all day at work. Pain subsides at rest. There is no pain, radiation, tingling, numbness, or associated trauma with this back pain. She does complain of some feet swelling at the end of the day, but the swelling decreases with rest and elevation of the feet. On examination, no varicose veins were noted. She also reports forgetting to mention her previous history of genital herpes because she has not had an outbreak in years, but is concerned that she has now experienced an outbreak with itching and painful sores and is requesting Zovirax. She has not been sexually active since the outbreak. She is denying any nausea and diarrhea or any abdominal pain. She denies cramping, vaginal discharge, or bleeding, and is not reporting any contractions, denies dysuria, hematuria, or frequency, and she currently denies any headaches. So this patient's past medical history, she has a history of IBS and this previously unreported case of genital herpes. She denies heart disease, hypertension, rheumatic fever, TB, venereal disease, or any GYN disorders. She denies any nervous mental disorders, diabetes, thyroid problems, seizure disorders, blood disorders, or surgeries. This patient is not allergic to any medications and is currently only taking her prenatal vitamins. She has not gotten the flu vaccine this season yet, but she regularly gets it every year. She is up to date on her Tdap. Her last one that she got was in 2015. She is quantiferon negative in 2019. She had the HPV vaccine, the first and second one. As far as her social history goes, she works full-time as a grocery store clerk. She's married. She does not smoke and has never used illicit drugs. Prior to her pregnancy, she reports she drank 3 to 4 alcoholic beverages per week. But like I said, she has stopped that since she's been pregnant. And she's an avid exerciser and still works out at least 5 to 6 times a week. As far as her OBGYN history goes, like I mentioned, she's gravida 1, para 0. She receives routine pap smears and has not had any abnormal pap smears. She does have a history of this genital herpes, but like I mentioned, has not had an outbreak in years, and no other sexually transmitted infections are reported. Patient information, she's 5'6", weighs 145 pounds. Her BMI is 24. Her current blood pressure at the clinic was 94/58. Her resp rate was 16. Her heart rate was 73 and regular. She was afebrile with a temp of 98.7, and she was saturating at 100% on room air. So in general, she was very pleasant. As far as her skin goes, it was clear, no other rashes or lesions except for the genital herpes lesions that she reported. As far as abdomen goes, her fundal height was 31 centimeters. Fetal heart tones were 148. Abdomen was soft, non-tender, no masses or hernias noted. GU, like mentioned, she denies any GU symptoms. Urine dip was negative for leuks, nitrates, glucose, protein, and blood. On her pelvic exam, external genital localized vesicles were noted without discharge. and they are on both the right and left labia majora, otherwise normal, including no blood, no enlargement of lymph nodes, no hernia, and no discharge. Extremities, at this time, there's no edema noted. So labs that we did, her 1 hour glucose tolerance test came back at 266, which was high. Her hemoglobin was 10.4, and she was found to be Rh negative. So as far as the assessment goes, number 1 was encounter for supervision of normal pregnancy at 28 weeks gestation, 3rd trimester. Number 2 was her complaint of low back pain. Number 3 was other infections with a predominantly sexual mode of transmission, which is going to further complicate her pregnancy. Number 4, she's going to be encountered for a screening for diabetes. Number 5, maternal care for anti-D, her negative Rh antibodies. Number 6 was maternal care for excessive fetal growth. So the plan for this patient was for labs, we're going to do the 3-hour glucose tolerance test. We're going to give a RhoGAM injection, or we did give a RhoGAM injection. And I apologize, she was not up to date on her Tdap, so we did update her Tdap at the clinic. The acyclovir 400 milligrams PO-TID times 5 days was prescribed. We scheduled a fetal growth ultrasound due to the elevated 1-hour glucose tolerance test and increased fundal height of 31 centimeters compared to the expected fetal height or fundal height of 28, expected of a 28 weeks gestation pregnancy. So we want to rule out large gestational age. Her estimated date of delivery is 11/2020. Referral to nutrition consultation, education on the importance of portion control. We taught her how to monitor finger sticks and log, including fasting. We will continue to monitor fetal movement, encourage her to drink plenty of fluids and stay hydrated, and rest as needed, especially during these times of such extreme heat. And she's going to return to the clinic in 1 week. So based on this information, I will post a complete SOAP note. And that's it. Have a good day, everybody.